after chiropractic school, moved back home. My wife and I had twins, and so we just wanted to be closer to home. And so I worked at another practice for about 2 years and just didn't really vibe very well. It was kind of, here's your room, here's your people. Didn't get to really leave the room, basically. I was just seeing a couple people here and there. And so after about 2 years, I was like, yeah, let's mix it up a little bit. And so found this place and just loved the whole structure of everything. I mean, it's not just chiropractic. We have chiropractic, decompression, laser, functional movements. We have dry needling. There's just so much that goes into it. It just felt like a better place if you really wanted to get people better, not just crack their back, that you would take them. I work under Dr. Molly, and so she's a senior doctor, so I'm her associate. So I do a lot of the actual treatment aspect of it. So I do a lot of the adjusting, and plus I just got certified with dry needling, so I do a lot of that as well with patients. But just seeing people go from barely walking to skipping out of here has just been awesome. So I think we do a really good job of not just dealing with your complaint. Obviously, you're going to have complaint. We don't want to downplay that, but the complaint is usually step 10 of what has happened. It's not like, well, now that this hurts, this is all we're going to focus on. Well, no, this hurts because something else downstream, upstream, wherever in your body is going wrong. And so what we do a really good job of is we do x-rays, we do blood work, we figure out what is causing this, but then we don't just treat what this is. We treat, okay, this is happening because you're not taking care of this, and this that you're not even feeling is brewing in the background. We need to address this before you come back 3 years from now and you're like, why is my neck hurting? Well, your neck's hurting because, like we told you, this is an issue, you just don't feel it yet. And so I think just our basic diagnostics and initial evaluation, taking the time to really dive into not only what you're complaining about, but figuring out there's other stuff kind of lingering in the background that we need to address and at least inform you of, because knowledge is power. If you don't know what's going on, you can't decide to make a choice to fix it. And so I think the fact that we really dive into what's hurting you, but what is really your goal? Why are you in here? Are you unable to pick up your kid? Did you used to play basketball and now you can't? Not just my low back hurts. Well, how is that affecting your life? Not just that it hurts when I wake up. Oh yeah, I stopped working out. I need people to help me with the groceries. You kind of have to really dive in a little deeper, which I think a lot of the doctors here do a really good job at. Is the person comes in not even thinking they're going to talk about this, or not even really connecting the dots that, oh yeah, it's really difficult for me to even get out of the tub, but that's not what I'm coming in here for. But we put the pieces together better, I think, than a lot of chiropractors for sure, but then just a lot of practitioners in general, where they'll ask you about your issue, give you a pill, ask you about your issue, adjust it. But it's like, great, that feels good for today, a week, a month even maybe, but it's not fixing anything. It's just putting a band-aid. You know, we try to teach people that you can go one way or the other, and it's totally your prerogative. We're happy with you getting adjusted if that's what you want, and never coming in until you're hurt again. But if you want to fix this, if you want to actually change your life, here's what we can do to help. And, you know, explaining that all to them and just hearing their why of what they need in life, I think is the best thing we do. That just sets us apart from people. That's what I would say is like our passion's like, yes, we love helping people feel good today, but what about in 10 years when something that's not even causing you pain right now is lingering? And if we catch it before it causes you pain, you avoid surgery, you avoid medication. And that's, I think, one aspect that a lot of people don't consider in healthcare is just, we want you to feel good, but there's a lot of preventative stuff that we can catch now so you never even have to feel bad. I'm the only one who does dry needling, and so that's pretty interesting in the fact that it really helps with a lot of neuropathy type stuff, and it goes hand in hand really well with decompression. Let's say you're having a sciatic issue, numbness, tingling, burning down the leg. Decompression is going to help actually heal it because it pulls your vertebrae apart, rehydrates your disc, you're getting less compression on the nerves. But what dry needling does is, let's say your calf is just on fire. Literally, it feels like it's on fire. One decompression session isn't going to clear that. What the dry needling does is it helps reset the muscle nerve connection, because you put the needle in and it causes a spinal reflex between the muscle and nerve, which then basically resets how the muscle is contracting. Because a lot of time, let's say neuropathy, it's not necessarily just the vertebrae compressing on the disc. That's the cause, but you're having a lot of muscles also compressing on the nerve going down to the leg. And so releasing the muscles around that nerve will help take some of the pressure off and just at least help to relieve the sensation and the symptom you're feeling while we're simultaneously doing decompression. Because like the kneeling isn't going to heal a disc, because you still have to move that disc back, but it'll get you through a lot of the pain you're in while you're doing the treatment. And so that's what I've had just awesome results with sciatica, carpal tunnel, even like jaw pain. The kneeling is just, it's amazing for releasing those muscles that are causing it to either shift one way or the other, and then just kind of almost let the muscle breathe again. It's really good for like if people have weakness in one muscle, let's say they can't lift their toe up because they have a drop foot, putting the needle in there, doing it a little differently, as in we're waking the muscle up. Because some people think, well, this muscle's tight and I can't do anything because this muscle's tight. Not everything is the tight muscle. That's just what you hear. here. You know, it's like, my muscle's tight, I need to work it out. Sometimes it's weak and it's not getting the signal from the nerve that you need. This just brings it back to baseline. Whether it's too tight or it's called hypertonic or hypotonic, it brings it back to neutral. And then it lets your body kind of relearn how to fire these. I've had really good results just doing that for, any part of the body. It's just cool because like before I was able to do it, I was like, oh, once I can do dry needling, I know this will help. And then sure enough, I have patients who we try dry needling and it's like night and day. Obviously it's still needles, so it's not necessarily the most comfortable thing while we're doing it, but the results I've had are just so fast and so just helpful for symptomatic relief. Because again, it's not necessarily healing your vertebrae, but for symptomatic relief, it's sure as heck a lot better than taking OxyContin. That's what I found is just really cool with what I've been able to bring that they didn't have before. Adjustment is going to help keep it moving so it's not stuck. Decompression is going to open it back up and help heal the disc, and the needling that I do with it is going to help with the symptomatic relief as well. And so it's all the pieces just come together really nicely. Yeah. So basically what our decompression bed does is we have a vertebrae. In between your vertebrae, you have your disc. And what this does is basically cushion your spine. So when you're running, lifting, jogging, it's not bone on bone and compressing. So you have cushion basically when you're doing stuff. A lot of people, when you get disc herniations, degenerative disc disease, your vertebrae here get closer and closer, eventually touch, but then as you can see, right here, your disc will protrude, compressing on this nerve, and then you'll have symptomatic expression downstream. You'll have numbness, tingling in your hands, feet won't be able to work as well, you'll have negative symptoms. And so when you have a bulging disc, what our decompression does is we hook you up and it pulls it open to help put that back where it belongs, basically. Slide it back in, and then it rehydrates the disc because your disc is mostly water. When you're rehydrating it, it provides it back into this water balloon cushion sensation versus just beef jerky here, which when you get beef jerky in between your vertebrae, it's not a good thing. And so this helps rehydrate it, takes pressure off the nerve, helps to relieve the symptoms downstream. This is the best thing we have for any type of neuropathy, sciatic pain, carpal tunnel, because we have one for the neck as well. It really helps actually heal the issue, not just put a Band-Aid on it. Everyone's different, so we just base how you're feeling off of it. We base how it's looking, because we do check x-rays again after a certain number of visits. And so it's not just, oh, you feel good, you're done. It's like, once you feel good, that's when the actual work starts, because it's easy to deprioritize all these when you feel good. And then when it starts hurting again, of course you'll be back. But when you feel good is when you have to actually realize, now I'm doing the work to make it feel good longer and longer.